Chief Administrative Officer at HRDC for the last 15 years. I am also the Chief of the Ponset Club Food Program in Nepal. So usually, thank you is the last slide, but I would like to start my presentation with thank you, many thanks to Miracle Feed, the entire team of Miracle Feed, Daphne, Faisal Bhai, Emmanuel, and the entire team of the Miracle Feed. Because of your partnership, HRDC has been able to solve so many children in need, so many children who are in dire need of our services. HRDC is like a local champion backed by an international champion, Miracle Feed. And this partnership has been impacting so many children in need in Nepal. So thank you so much to Miracle Feed. Globally, around 200,000 babies are born with club food. We all know that, and 80% of those belong to low and middle income countries. From the statistic of Miracle Feed, it is estimated that every year around 782 children are born with club food in Nepal. And even though club food is one of our major program and very successful program, we have been able to reach just around 582 children in the last fiscal year. So it shows there is huge gap. We are doing more and more, but more still there is huge gap and needs to be done more. So let's start with the story of a child who have been treated in 2008. This little girl belonged to a Palpa district, which is one of the most remote and unreached district of our country. And she was treated through our club food program. But the important thing is, we keep on following them. We don't leave them. We keep on following them till the maturity years, because we all know the bone might get, the deformity might get recurrent. So we keep on following them. And the same girl, you can see the change after a 15 years follow-up. The food is at normal, is corrected, at a normal position. She is living an independent and dignified life. She is able to participate in the household activities, in the community activities. She is continuing her education, and she is very young. She has grown up and living a dignified life in her community. Who would otherwise be isolated, neglected by her community if she was left untreated. So this is the impact of our greater partnership with Miracle Feed. This is the impact that we can bring a real change in the life of an individual. So a little bit of history. HRDC was established in 1985. It's 40 years old organization. We are 100-bedded hospital which provides around 25,000 consultations every year. And Club Food is one of our major programs which provide on an average more than 500 Club Food here every year. So far, more than 123,000 children with physical disabilities have been rehabilitated through HRDC's intervention program. More than 50,000 has gone through major reconstructive surgeries. Over 100,000 artificial appliances have been manufactured and distributed to the needy one, and more than 10,000 club food cases have been treated from our services. So if you look at the barriers to social participation, at least in our part of the world, there are 4 barriers which prevent an individual to participate in the society. Unfortunately, gender is still the number one barrier which prevents an individual to participate in the society. Disability, illiteracy, and poverty. So if you look at this little girl, all those 4 barriers which I talked about applies to this little girl. She belongs to a poor household, never gone to education. She is a girl child and has a gross disability. So can you imagine the life of this little girl if she was left untreated? Disability is still considered as a bad deed of the past in our community. And I'm sure all of us belong to the same community where disability is considered as the bad deed of the past. There are so many social stigmas attached with the club food and disabilities. The more the family used to be blamed, and you know, the mother is one who has to suffer a lot. You know, the whole blame goes to the mother. You must have done something bad in the past, and you gave a birth to a child with clubfoot or disability. So this is pathetic situation in our community. You know. The brother had again the clubfoot. You know, so just imagine the life that family had gone through before the treatment, and they both of them belong to a very poor family background, uh, and because of the poverty, they were left untreated for years, you know, and because of, we are very fortunate that we were able to identify both of them through one of our outreach mobile clinic. We brought to HRDC, and you can see the change after the treatment. But we didn't stop there. We They were so poor, so we bought some goats for the little girl, and she started goat farming and started making a livelihood for her family. For the boy, we opened a bicycle repairing workshop, and both of them started making some livelihood, making some money for their family. They both are married now. At least in our family, nobody would give them their daughter or their son to marry them if they were left untreated. So they are, type of, if the this type of child are left untreated, they never experience the social life. But look at the impact of our services. Look at the impact of HRDC and Miracle Kids partnership. This little, both of them have started a social life. They both have children now, and there was a correct, when the right time came, we hired this little boy in one of our Ponseti clinic, and he is now serving the clubfoot cases, the condition that he used to suffer sometimes. So again, if you recall our